Good evening, Los Angeles, and thank you for joining us. I hope you all had a restful Easter, a good weekend, and thank you for all you did to stay at home when I know this was traditionally a weekend we would have loved to be outside, to be with family, over dinners. Thank you all. And I hope for those of you that were marking Easter, it was a meaningful day full of the services remotely that connected us with something bigger than ourselves and reminded us that we will get through this because of the connections that we share as a city family and as human beings that care for one another. I know this can be a befuddling crisis. Almost feels like driving down a foggy road that's bumpy. You never know when there's going to be an off-ramp, when the next bump will hit. There's so much that seems unknown. The dates of the future when we will go back to life as we know it, the moments in which we will be able to see and hold loved ones again. But I want to reassure you tonight that there is a lot that we do know. For as much as we don't know today, and we're learning a lot about this virus, we're learning a lot about how to potentially reopen society, there is still a lot that we do know. And that's what I wanted to focus on tonight with each one of you, to share with you the data that I get from some of the best people in our city, our country, and around the world, whether that's doctors and public health officials, economists, statisticians, and others that are helping guide the decisions I make on your behalf to make sure that we save as many lives as possible and restore as many livelihoods as possible as well. But today, let's start, as we always do, with today's data before we get into that richer conversation. Today in our county, there were 239 new confirmed positive COVID-19 cases, bringing the total to 9,420 cases. This was a 2.5% increase from yesterday. In the city of Los Angeles, there were 113 confirmed new positive cases, bringing our total here in the city to 4,205, a 2.8% increase since yesterday. In the past 7 days, our city has seen an average daily increase of 441 new cases, down from a peak of 559 cases last Monday, and the total number of cases have been now doubling approximately every 20 days. Only a week ago, they were doubling every 7 days. This is also the 8th day in a row of a single-digit increase in confirmed positive cases of COVID-19. That's great news. But there are two important parts of that statement: single-digit and increase. The single-digit part confirms what we hoped, that by all of us staying at home, we are flattening this curve, and that's great. But the second part of that statement, that every day is still bringing an increase, means that this is still getting tougher each day. Just because the rate of increase is slowing, it doesn't mean that the number of hospital beds that we need, the number of cases that doctors have to tend to, the potential deaths won't continue to increase. So balance those two things, that your work is paying off and those single-digit increases, the single-digit part is great, but until we have a day in which there are no increases and more people are coming out of hospitals than going into them, we still have our work cut out. And today, most tragically, we learned of 25 new deaths here in Los Angeles County. That brings the total number of fallen to 320, and that's an 8.1% increase since yesterday. As we see, that statistic is increasing still at a higher rate than our overall cases, which means that still for some time, the toughest cases and the worst resulting in deaths will still keep staying with us for the near future. Our deaths are now doubling every 6 days. So we're making some progress, but since my last briefing on Friday, we've lost 79 Angelinos, and our heart breaks for the families that mourn those people today. Those are real people with real lives, and their families and friends today feel that pain, and we are with you. As we prepare for the peak of hospitalization, we continue to closely track hospital bed inventory as well. Across the county in our general emergency hospitals, there are a total of 2,132 beds available, with 1,601 acute care beds and 531 ICU beds, and an inventory of 1,025 available ventilators. Excuse me. Testing is absolutely critical to our ability to track this outbreak and flatten the curve, and so we are scaling up and ramping up this effort. Most of the test sites are drive-thrus where the tests are done in the patient's car. This has been convenient and, of course, in a car-based culture, something that Angelinos love. But since many Angelinos don't have cars, we've begun partnering with local clinics to provide walk-in testing. We opened our first location, Carbon Health in Echo Park, a couple weeks ago. And tomorrow we will launch, I'm very proud to say, our second walk-in facility. And this will be in South Los Angeles in the Kedron Community Health Center. This is very important because it's the second move we've taken to serve African Americans and lower income Angelinos when we saw troubling statistics that this was disproportionately hitting Black community and low income Angelinos. We now have 24 testing locations across the city and the county, and we've now tested more than 46,000 people. And today alone we had slots for 6,500 tests, our highest number yet. Excuse me. As I reminded folks, anyone with symptoms can now get tested. And if you go to coronavirus.lacity.org/testing, you can see if you can schedule a test. Now, with that local data in mind, tonight I want to take a look at the bigger picture with you, how this pandemic is playing out by the numbers across our country. Now, I want to reassure, I've coughed, I know, a couple times. I want to reassure people this is not a COVID-19 cough. My daughter had a cough, and I caught it a couple days ago, was tested, and I'm fine. So bear with me tonight. With that local data in mind, I want to look at this bigger picture. The United States now has more cases of COVID-19 than any other nation on earth. And unfortunately, we have lost 23,000 American lives. New York remains the epicenter of this outbreak, followed by New Jersey, Massachusetts, Michigan, and Pennsylvania. In terms of absolute numbers of cases and deaths, California is 6th with 23,500 cases and 683 deaths. Per capita, though, the numbers are a little bit better. We're 28th in cases per capita and 45th of the states in deaths per capita. And I want to underscore that because it says how important it was that we early, on March 15th, took the actions that we did in this city. And later that week that the state took actions throughout California. There is no question in my mind that so many deaths were averted because of those actions. In our state, LA County has, of course, the highest population and the highest number of cases of any county in California. We have the second highest rate of infection and the highest rate of death, with 88 cases and 2.7 deaths for every 100,000 people. Put differently, we're about 40% of statewide cases here in LA County, LA City about 17.9%. A variety of groups have been creating models that look at projections of the future. They look at national and local trends. The Institute for Health Metrics and Evaluation shows us that California may experience our peak hospitalizations on April 17th, this coming Friday, and that we may have our peak in new deaths on April 19th, this Sunday. But these projections, and as I mentioned, there are many out there, only work on the assumption that we keep up our work of the physical distancing that we have done and must continue to do. If we take our foot off the gas right now and stop physical distancing, models show that our hospitals could be overloaded by May 12th, meaning that there's not enough beds for the number of patients that we would have. And we have numbers for what relaxing our aggressive measures might mean. Folks have asked me all the time, can we stop now? What if we just went back tomorrow? Well, let me play those projections out. Epidemiologists, including those at the county, tell us that if we relaxed the physical distancing and stay-at-home orders now, we could see as many as 95% of LA County residents contract COVID-19 by August 1st. And I don't have to tell you what that would do to our healthcare system, how many people would die because we wouldn't have enough beds. So it underscores the importance of why we double down on what we're doing. So the only way to stop that from happening is to continue to stay safer at home, to practice physical distancing, to only go out for essential trips, and to try to limit those as much as possible so that we don't see a spike that overwhelms our hospital system. We know the consequences of stepping back too early because we also have history to guide us. So let me talk to you a little bit about that tonight. Over the last century, there have been 4 flu-related pandemics, the most devastating being, of course, the influenza pandemic of 1918. Now, data reporting and quality was a little bit limited back then, but we have some interesting information. And it was estimated today that about 500 million people were afflicted with that influenza, that H1N1 influenza, and that about 50 million people died, more than in World War I. In the US alone, the death toll is estimated to be at 675,000, more Americans than died in our bloodiest war in history, the Civil War. We've all heard the comparisons between the H1N1 influenza of 1918 and today's novel coronavirus known as severe acute respiratory syndrome coronavirus 2, which causes the disease known as COVID-19. Both viruses were brand new when they hit, so nobody had immunity. Both were highly contagious, and both had high death rates. The fatality of the H1N1 in 1918 was estimated to be about 2%. We don't yet know what the fatality rate of COVID-19 is. It'll take a long time for us to understand that full scope. But at this stage, the fatality rate is believed to be about 5 to 6% globally, and about 2 to 3% here in the United States. And it's important to remember the 1918 flu spike saw not one, not two, but 3 separate spikes. In many cities and countries across the globe, it was the second spike that was the most deadly. One of those places that was hit was San Francisco. The Bay Area was hit in the fall during the second of 3 waves. And this was at the peak of the pandemic, at the point at which most Americans died. But in 1918, San Francisco acted fast. The mayor with the Board of Health and the Red Cross did something that will sound familiar to Angelinos today. Told people to practice physical distancing, cover their faces to stop the spread of the virus. And most San Franciscans obeyed the order to cover up and stay apart. And as a result, the city saw a huge drop in numbers of people who were becoming sick and who were dying. So, in November 1918, the city eased up. They said, "We've done our job." Schools reopened, distancing measures were relaxed, and people were allowed to take off their masks. And within 2 weeks, the flu was back, and in December alone, San Francisco had 5,000 new flu cases and many deaths. Meanwhile, as San Francisco had relaxed its social distancing, here the city of Los Angeles declared an emergency and maintained its ban on all gatherings. And the two cities saw pretty different outcomes. According to a recent MIT Federal Reserve Bank study, LA suffered 485 deaths per 100,000 residents. San Francisco much higher, with 648 deaths for every 100,000 residents. And after the flu pandemic was over, Los Angeles, with its longer physical distancing, saw 69% employment gains, compared to 42% employment gain in San Francisco. In other words, less lives were lost, and by staying in this longer, the economy came back quicker here than up north. This lesson tells us 3 things. First, the steps that we're taking right now to flatten the curve, to do this work, is saving lives. Second, it's critical to be able to relax or tighten restrictions as things change. But most importantly, as the head of the World Health Organization said recently, lifting restrictions too quickly could lead to a deadly resurgence. And unfortunately, we're already seeing that with COVID-19. There's news that Japan's northernmost main island has declared a state of emergency less than a month after they lifted their stay-at-home order. They started to open schools, to allow public gatherings, and had nearly a week of double-digit increases in the number of cases. These are the hard truths that guide me, the data that I'm using to make these decisions each night. When we think about the process of safely reopening, as I consult with my colleagues, and today I want to thank my fellow mayors who got on another conference call that I led with the mayors of across Los Angeles County who are struggling with these same issues, and of course the marvelous leadership we've seen from the county, from our Board of Supervisors, its chair, Catherine Barger, and our own Dr. Ferrer, who has led all the public health decisions. As we look to the past for lessons, we're also watching how cities and counties and countries across the world are navigating this question of reopening. With our infection a few weeks or more behind other countries, we're in a good position to watch them take these moves first and learn the lessons of what works and what might not. 2 places we're studying closely, of course, were where the epicenter of this started, in Wuhan, China, and also in South Korea, which have very different approaches and outcomes. Both places are dealing with the reality we all will deal with. Even after this wave of infections ends, the threat of another wave doesn't go away for all of us who don't contract COVID-19. Wuhan was the first place that had to deal with this, saw over 60,000 infections and more than 3,000 deaths in a single city. And last week, after a 76-day lockdown, the government reopened its borders but kept many restrictions in place. South Korea and the United States confirmed their first cases of COVID-19 within a day of each other, but South Korea had more success, managing the virus with far fewer infections, with many more tests, only 10,000 infections and 200 deaths. And without implementing the kind of total lockdown that we saw in Wuhan, South Korea has used technology and testing, public information, tracking, and tracing of cases to stem the virus and to keep society relatively functional. In the coming days and weeks, we're going to continue to monitor how these steps take hold in China and South Korea, how folks begin to go back to work or look at things like reopening restaurants. We're going to look in Europe, where some countries have started looking and have announced that soon they will begin in limited ways some reopening, so that we can adopt those best practices and bring them here. The road ahead, while still foggy, is becoming clearer every day. There's a lot that we do know, things that are helping us keep Angelino safe now and that will help save lives down the road. We know that we should prepare now for a second and even third spike of COVID-19. History teaches that. We should all be prepared, even as we come out, that we will probably have to go back in once or 2 times more. We know that places with robust testing and tracking and tracing facilities have done a much better job managing this crisis, making sure their hospital systems are paced and are not overwhelmed. And we know that the sooner cities and countries have mandated aggressive behavioral practices, the more effective they have been at controlling the spread of the virus and preventing or mitigating its resurgence. As we move forward, data and evidence will guide every one of our decisions. And I want to share with you, this is the deck I get every single night. It has all of the data and the charts that show relative cases, the deaths. This is marvelous. It's been put together by my Chief Innovation Officer, Amanda Daflos, and her team. And I said, we should be sharing this with all of LA. So starting tonight, what I get every day, you'll get every single day. In fact, you can go and find this right now at coronavirus.lacity.org/data. Easy to remember, coronavirus.lacity.org/data. And we also know as much information as you need to know. There's a lot of disinformation that we want to make sure, or misinformation rather, that we want to make sure you can dispel. There are so many myths swirling around. I've dispelled many of them in these evening addresses, but folks are worried they'll be arrested for going outside, confusion what it means to be asymptomatic. So we're launching another page tonight that is about dispelling this misinformation and disinformation at coronavirus.lacity.org/myths. Check it out today, so the next time your friend texts you or you see something up on Facebook, you can point them to the truth. We will learn from history. We will continue to listen to experts. I will rely on those professionals, not people who are making political decisions, but who are making medical decisions for us. And we're bringing people together to already start talking about how LA can one day get back to work. One of the most decisive actions we've taken to save lives came last Friday, when we joined the County Department of Public Health to extend the city's Safer at Home order through May 15th. I know it was heartbreaking for a lot of you to hear, and it was heartbreaking for me to say. But that said, we know that it reflected our commitment to stopping the spread. And today, along those lines, we heard from LAUSD, the board, and Superintendent Buettner, that LAUSD schools will remain closed through the summer. It's the right decision, and I thank you for that. While we're focused on the here and now, we do need to begin to think about how we will reopen the economy. And I look forward to working very closely with Governor Newsom, who I spoke with on Friday, and the mayors of the 13 largest cities in California, where we're sharing this conversation about how we can do that from San Diego to Long Beach and Santa Ana, Riverside, Los Angeles, and all of our friends in the Central Valley and Northern California. But as we track all of this data, we remember that behind every number is a neighbor. These aren't statistics, these are stories, our flesh and blood, fellow human beings who are in our families and our communities, and they need our help. There's so much suffering going on out there. I know there's suffering for some who don't like being at home, but for others, they're not just at home. They don't know if they'll be able to feed the family. They don't know if they'll be able to make the rent. They don't know if they're going to get through this, even if COVID-19 doesn't get them. And no matter no matter when we promised assistance from Washington, we know that it simply won't be enough. What's coming from Washington isn't enough and it doesn't go to enough people. The magnitude of what we face requires something even more urgent and complete. And that includes the private and nonprofit sectors, who, as I've shared with you each night, have stepped up in an incredible way to help us build up our capacity to help others with cash assistance to families. And that's exactly what's needed right now. Fortunately, our Mayor's Fund for Los Angeles, which I know sounds like it's something in City Hall, but it's a 501c3 nonprofit, not controlled by me and not in City Hall. It was able to partner with a national nonprofit organization that I also helped create, Accelerator for America, and MasterCard's City Possible Network to create the Angelino Card initiative. Angelino Cards are very simple. No-fee debit cards that provide cash assistance to families here and individuals in Los Angeles who need the help. Your household is eligible as an individual to get $700, $1,100, or $1,500, depending on your income and household size, if you meet 3 criteria. If you live in the city of Los Angeles. Second, if your family's total annual income had fallen beneath the federal poverty line prior to the COVID-19 crisis. And third, you and your family have fallen into deeper economic hardship during the crisis because at least one family member has lost their job or experienced a reduction in income of at least 50%. You can apply online. We know that there will be more demand than money, but I'm committed to every single day picking up the phone and still calling more. And I hope folks out there that can help will continue to help us, because just as we did with the grocery cards that in 4 or 5 days were gone, we know that this will be gone too, and we need to keep getting these cards out to people who need our help now. But you can sign up at hcidla.lacity.org anytime between 8:30 a.m. Tuesday and 4:30 p.m. on Thursday. And if you don't have access to the internet, you can call in those same hours. And I want to be clear, you can't go online other hours. We wanted to make it fair for folks who don't have an internet connection and who rely on a phone, that they wouldn't have everything taken by those who have access to the internet. So for both the phone and internet, it's from 8:30 a.m. to 4:30 p.m. starting tomorrow, and you can call 213-252-3040 on Tuesday, Wednesday, and Thursday. So that's tomorrow, Wednesday, and Thursday. But please only call if you don't have internet access, so we can make sure that people without internet access can get through. And I'd like to thank the staff of our HCID department, our Housing Community Investment Department, and our Family Source Centers, which have been there for years for LA City residents, for providing critical support for Angelinos in need. Those who pre-qualify based on their online or telephone applications will be given an in-person appointment at a designated community center. And please know that these centers can't help anybody without an appointment. So that's to keep our workers safe and to maintain a safe social distance. We can't accept walk-ins. So please go through the online or phone call system, get an appointment, and come on in. And please know that applicants will not be asked anything about their immigration status, nor will immigration status be considered in determining eligibility, because we're all in this together. We are all Angelinos. And I hope that our federal government will listen to that too. Those who are cleaning our hospitals, those who are picking our food, those who are working in our warehouses, it doesn't matter what their legal status is today. They are here as Angelinos, and we will help them no matter what. To be clear, this initiative is funded entirely through private and foundation donations. It's not a city program, and any assistance through this fund is not considered a public benefit, so it's not subject to any public charge rule from the federal government that might scare some away. You are safe, don't have any fear. Please, if you need help, reach out. And households may be eligible regardless of whether workers within them earn W-2 or 1099 income, were or are otherwise independently employed as domestic workers, day laborers, or street vendors. For example, if you are a seasonal worker in agriculture or tourism. And households currently receiving public benefits, including unemployment, are not disqualified if income requirements are met. The Mayor's Fund, Accelerator for America, and MasterCard City Possible Network specifically designed the Angelino Card to help Angelinos that are overlooked by other federal cash grants, as well as the unbanked or other populations who we know might be left behind if we didn't step up. And I want to say thank you to this partnership for creating a solution for how to physically distribute financial assistance and serve those ineligible for federal aid. We will remember you and thank you. And with applications opening tomorrow, we will get debit cards in people's hands beginning 1 week from tonight. The number of people we'll be able to help, that depends on all of us. I've certainly donated. I hope all of you will consider donating. Amounts from $5 to $10 to as high as $2 million. We've had people step up all around the city. And due to limited resources, if the number of qualified individuals exceeds the number of available cards, Angelino Card recipients will be randomly selected from among the qualified individuals for this round, and folks will be kept in that list for hopefully future rounds as well. If more donations come in, we can help more people. So please go to mayorsfundla.org/Angelino or text LA Love to LA Love to 21,000. And we rolled out, actually I want to make sure I get that right. It's texting 21,000 to LA Love, but I think that might be backwards. I'll make sure I clarify that. We rolled out grocery gift cards last week as an initial step towards providing debit cards, and we exhausted our supply of $1.2 million in gift cards generously provided by Jack Dorsey and Albertsons and Kroger in just 4 days. And yes, I've confirmed it's 21,000 is the number you text. LA Love is the data that you put in that message that you can donate directly. So we need to know the demand, we know that the demand for this will be immense, and we need your help more than ever. So I know that's a lot of information to digest. I hope that this data deck will provide useful to you and to your loved ones. It's this information that is knowledge, and this knowledge that is power. Power for us to get through this, power for us to reassure each other, power for us to feel our way through this. And we're preparing for whatever comes next. This city is going to continue working. I'm going to keep working every single day. Haven't taken a day off yet, and I won't until we are done with this. That means all of us are going to have to dig deep into a reserve to reassure one another, to show that LA love to one another, to demonstrate the strength of LA, and to make sure we get through this together. So keep doing your part by staying safe, staying healthy, and staying home. Strength and love to you all, Los Angeles. With that, I'm happy to answer questions. Thanks.
And our first question comes from the line of Claudia Pashuta from KNX News Radio. Please go ahead.
Hey, Claudia.
Hi, Eric. On Friday, I asked you about cases among city workers, those who've tested positive and people in quarantine and isolation. I did follow up with your staff. I have yet to get any information on that, so I'm wondering if you have any figures on it. Also, if you could provide more details about virus-related deaths of city workers. You had mentioned 2 on Friday. I'm wondering if it is still 2 people and what departments they were from. And third question, do you think we ever get to the point where testing restrictions are lifted and we're testing asymptomatic people to find silent spreaders? And if so, when might that happen? Thank you.
Thank you. We do have in the city of Los Angeles now over 100 confirmed cases of city employees, 125 to be exact. As I've shared with you, there are 17 cases today from the fire department. That's 16 firefighters and 1 civilian. 8 have returned to duty. In the LAPD, it's 55 with 43 police officers and 12 civilians. 10 officers are returned to duty. It is only 1, I misspoke and I apologize, it was a family member. We're not naming what department that is based on the family's wishes right now, but as soon as they say it's okay, we will share that with you in coming days if they do. In terms of testing, and remember, that's out of a city employee group of about 40,000, so knock on wood, we've been pretty lucky, and certainly compared to first responders, I especially want to thank our firefighter paramedics, who are literally the ones doing these transports and obviously interacting with people who have COVID-19-like symptoms. They've done an extraordinary job of using all the procedures, their PPE, We are behind the men and women of this fire department every single day. They've been out there at our testing centers helping those get up and running too. So speaking of testing, right now public health officials are recommending to us, with the growing but still overall limited numbers of virology tests, that it doesn't make any sense to have asymptomatic people take those, that we still need those for people with symptoms. Overwhelmingly, we don't have anywhere close to 10 million tests, for instance, for all of LA County, or 4 million for LA City. But what is moving forward this week is the first random testing of 1,000 folks. We've worked closely. You heard me appeal for a donor, and thank you to USC for stepping up to make sure that the costs are covered on something that was going to go once a month. Now we'll go once a week with 1,000 random Angelinos to take a blood test, usually a pinprick on your finger, drop of blood, and then to see whether you have had COVID-19 or you've had the coronavirus inside your blood. So that is something that I hope that we see many, many more tests nationwide. There's only one that's been authorized by FDA. There's a number that I think are permitted but not approved by the FDA, and many under development. And we need to see not only tens of thousands of those, but hundreds of thousands if we're going to get a place back just in LA alone where we can return some people potentially to work. But I want to be really clear, there will be the overwhelming majority of folks will come up with a negative, which means most of us thankfully have not gotten this, which means it's a different set of rules. Those folks don't necessarily get a passport, an immunity passport to go to work, but it may be those who have survived COVID-19, gotten through it, who have the positive tests, who will be able to have some sort of more robust return to society once we decide to make those moves. So right now, it is something in which we hope to see more. We've got those 1,000 a week now going out randomly. There's some limited availability out there, but don't take a blood test to see if you're infectious. It doesn't tell you whether you're infectious. So there are people who don't have the antibodies in their blood yet, but who do have coronavirus, can spread it to others, and that's why the virology tests are so important at our drive-in centers and walk-up centers. And I've confirmed a third time, you just text LA Love to 21,000 to donate. Thanks, Claudia. I'll take the next question.
Our next question comes from the line of Alex Michelson from Fox 11 News.
Hey, Alex.
Go ahead.
Mayor Garcetti, Governor Newsom says he's going to have a plan in terms of reopening California tomorrow. Are you working on something similar? And on a personal note, glad to hear you're doing okay. Did you meet the symptoms necessary for a test for coronavirus? Would you meet the criteria?
No, I've had no fever or anything like that. I will be honest, I took a coronavirus test just to make sure, and I am negative. That said, in terms of looking at the governor, he's not going to be releasing a plan tomorrow. It's more of a framework, and I think he's done a marvelous job of looking at this regionally. Just as East Coast governors did, he's now looking with Washington, Oregon, and California, the governors together. We'll talk about the approach that is necessary, and this really builds on what a lot of us have been saying. Get the testing out there, especially for blood tests. Get the tracing and tracking regime set up, and that might be thousands of new people, and especially some of those that are out of work would be great to train, to have a kind of CARES core, as I've mentioned, to get out there and to help people not only know whether they are positive or negative, but also inform people about some of the programs that can help them get through this as individuals or businesses. So we're looking forward to tonight. I'll be on the phone call with all of my fellow mayors up and down the state that we have each evening. We'll be talking to his chief of staff, and they'll be previewing some of that. But everything we've heard, it's really about an approach to. It's not going to be a detailed plan where you flip through the pages, this date, this opens, these people go back to work. I think it's going to be the beginning of the principles that are there. But as we know, as we've seen with testing, as we've seen with procurement of PPE, as we've seen with all of these things, it's going to really depend on local governments implementing this, which is why I'm joining a bipartisan coalition of mayors led by myself and the mayor of Oklahoma City, who have called for, with doctors, the creation of the federal funding to enable a return to work system, to come up with the guidelines, to fund the people necessary, to do the tracking, the tracing, the rules for workplaces and public places. So absolutely, we've been working very closely, and I've done that all hand in hand with Supervisor Barger, Dr. Ferrer. We're talking later this week about that, and bringing the other cities of LA County. We also need to do that as a region, I believe. The other counties that are around us, the 5-county region, it's really critical from the Inland Empire to Ventura to Orange County to take those moves together, and probably San Diego. So that's the approach we've been taking. It's marvelous to hear folks starting to do that. I'm looking forward to what the governor has to say. Thanks. Next question.
Our next question comes from the line of Steve Gregory from KFI News. Please go ahead.
Hey, Steve.
Hey, Eric. Good evening. I hope you're well. Listen, a couple things. Dr. Ferrer said last week that there's a flattening of the curve. Today she announced a one-day new caseload is the lowest it's been since late March. Are you worried that this sort of glimmer of hope through the tunnel is going to get people to sort of back off a little bit? Because, I saw a lot of people out and about yesterday as I was coming into work. And secondly, since there is supposed to be fewer people on the roads and fewer people out and about, are city crews using this opportunity to catch up on projects like potholes and road repairs and things like that?
Absolutely, Steve. Let me start with the second one. On Friday, I announced that we were moving from residential streets to some of our main streets and accelerating some of those infrastructure repairs. So absolutely. I think we've all seen those memes that people are sending out, like, fix all the roads right now. It's exactly what we were thinking. And so we do have those city crews with PPE and proper social distancing doing those sorts of repairs, especially on those main streets that we've been waiting for a long time and are such a pain to do, and we're all commuting. We're always caught between people saying, don't put those crews out there when I'm going to work or coming home from work, and the other half of people saying, can you do it more quickly? Now we've got the perfect storm, at least for that. Not a lot of people on the road, so we can do longer hours, and people don't have to worry about their commute. So we are absolutely accelerating that, and that'll be a smoother ride for all of us when this is done. In terms of the folks getting out there, I'm so glad you brought that up, because this is a crisis that plays tricks with our head, right? Early on, it doesn't feel very bad. Why would we close things down? As I said, when it still feels wrong, that's the right time to do things. By the time it feels right, it's too late. Similarly with this, when it feels wrong, it may be too early. In other words, when it feels right, it may be too early to open things up. So people are going to say, Dr. Ferrer said it's flattening, we're seeing fewer cases, but I want people to hear what a single-digit increase is. Single digit, way to go, LA. We're all doing the right things to bring down the rate of increase, but it still says increase, which means there's still more cases. Those are still backing up into our hospitals. We're building that capacity marvelously within our hospitals, and I praise all of our hospitals and hospital workers for that. I hope many of you have been joining me and my daughter. We got cowbells now that we do at 8 o'clock to thank our medical workers and the janitors who are there in the hospitals and everybody. But it's still an increase, so don't let up. When I shared earlier in this press conference that if we let up today, let's say we opened everything up tomorrow, one projection that was shared with me today said that 95% of us would get sick by August 1st. And with a 2% or 3% fatality rate, do that math here in LA County. That's 200 to 300,000 deaths, and there's no way our hospitals could even begin to deal with that. So your mind sees progress and says, let's let it up, but I want you to hear that when you see that progress, it should be a doubling down, not a letting up. This is a great week to consider not going out, to really stick to those essential things, to adhere to the orders, to wear facial coverings when you're out. In LA County, those go into effect on Wednesday night officially. It's already in LA City since last Friday morning at midnight. So keep with it, stay with it, no matter what your brain feels like. Listen to what the experts are saying, and let's make sure we don't have a San Francisco 1918 experience, but that we have an LA 1918 experience instead. Next question, please.
Our next question comes from the line of Chris Weber from Associated Press.
Hey, Chris.
Go ahead.
Hey, Mayor. You mentioned a new walk-up testing site in South LA, which benefits lower-income residents. Along those lines, testing can be especially tricky for those experiencing homelessness. Are there any plans to set up testing sites specifically for homeless people?
Yes, and it's a little tricky to set up sites because people are encampments or cars or shelters in different parts of the city. So we announced a week and a half ago, thanks to the UPS Everlywell partnership that we have, where UPS is delivering and picking up tests, Everlywell Labs are the ones processing that we went into our senior homes and assisted living places, but also our providers to people who are experiencing homelessness. So these are the clinics in the county that already do those sorts of tests. These are healthcare providers that work in places like Skid Row, doctors who go out there. And we're going to be testing new technologies. Hopefully we'll have some announcements later this week, but I'll share one statistic. We had 250 tests, I believe, that went out among the homeless community in one initiative this past few days. Of those, and I'll get you the exact numbers, I think it was 179 were negative, 2 were positive, and the rest are pending. So far, still very low numbers, which is great news to see. I remind people that folks who are housed had much higher numbers of COVID-19 than people who are unhoused. So this is not something coming from the street to people who are living indoors. It's vice versa. And we're trying to do everything we can to protect them, to test them. And it's my goal, hopefully, later in this week to talk about how we can get on the street testing that gives you some quicker feedback than a day or two, let alone 6 or 7 days later, where you might not be able to find that individual and let her or let him know what the results are. So we have some good things cooking. I hope to announce them a little bit later this week, but those tests are already at clinics, already with doctors who do that work as we speak. Thanks. Next question.
Our next question comes from the line of Hedy Chang from NBC Channel 4. Please go ahead.
Hey, how are you?
1 moment, please. Oh, 1 moment. Please go ahead.
Hey, Mayor, thanks for the opportunity.
You bet.
We just heard from a healthcare worker who's awaiting her test to find out if she's positive, and she was told to self-quarantine for 2 weeks. The problem is her mom has stage 4 cancer, and they live in the same house. So, she's terrified to go in the house and feels she can't self-quarantine without risk to her mom in that house. And I think that she's aware of the governor's healthcare workers lodging program. She's called 211, the county line, and hasn't gotten any immediate answers. Are there any immediate resources the city can offer her or anyone else in a similar situation who may not be able to self-quarantine at home?
Yes, there are hundreds of hospital rooms available for Tier 2 people. Tier 1, remember, is for folks that were not yet symptomatic, who live in especially vulnerable places or especially susceptible, like our unhoused population, folks experiencing homelessness. Tier 2 rooms are also available in the hundreds to take people who are need to self-quarantine and have no place to go, like in this case. So tell her to email us directly, mayor.garcetti@lacity.org, and we'll do everything that we can to make sure we get through any red tape. Those are online today. I know people that are in them right now, and she shouldn't have to wait any second. So if she wants to email us even tonight, she might be listening, please do that. Give us a phone number, we'll call you, we'll make sure you're in a room quick. Thanks for that, appreciate it.
Great.
Next question.
And our last question in English comes from the line of Elizabeth Chow.
Hi, Liz.
Please go ahead.
Hey, Liz.
Hi, Mayor. Hey, so I was wondering about the final order that was issued today on the Garcia case, and if you had any response to that. It's regarding the 5611 law, the bulky items part of it. And also, I really would like to see if you can provide an answer on the trailers that are still empty outside of the Granada Hills Recreation Center. I think a lot of people are wondering why they're still empty when people who are quarantined inside that shelter, I don't think they have any individual rooms to go into. And they also share a bathroom, and Dr. Ferrer said that even people who are quarantining should try to take those steps. Thank you.
Sure. So all of our advice of what we do at Granada Hills or any of the rec center shelters come from public health. So if we're doing anything there, it's because we have public health on site. They're recommending and approving anything we do. So there's not an ounce of air between us. Trailers that we have, a lot of them kind of are being connected and things like that, but that's not always where we will take people. hotel rooms and motel rooms may be where they move them, and these are available for when things get tough. So don't expect them all to be filled. And we also have ability to put people in there who are exhibiting symptoms but doesn't look like it's COVID-19, in a place for them to get well and to get healthy. So that's how those are being used in Granada Hills. Secondly, in terms of, no, I'm not familiar with a court order from today. I know that the judge in the overall case has asked for a conference tomorrow. He's a great judge. Judge Carter has been just amazing. I want to thank him publicly. We've been in regular communication. He's been out there visiting homeless shelters, sharing the same opinion I had when we didn't have the hand washing stations and bathrooms in good repair, so we're doing that now daily. And he's really been powerful, not only in Orange County, but here and now in Los Angeles, to help us with this case. But I don't have anything in terms of that. I know that on the bulky items, I don't know of any new proposal or new thing that came out today, but I'll research that and let you know if there's anything to get back to tomorrow. On the homeless front too, the numbers, I think we have 1,300 tests that have gone forward, and the ones that we did know of, that batch that I mentioned, it was 172 that were negative, 3 positive, and 34 pending, with one group of people experiencing homelessness as well. So that is, I think, the latest numbers we have there. Thanks, Liz. Next question, please.
And our last question comes from the line of Abel Almio, our only question in Spanish, from Telemundo 52.
Buenas tardes, Abel.
Hi, Mayor. Just wanted to circle back to something you mentioned last week regarding the earned income tax credit for undocumented immigrants. Mm-hmm. Has there been any developments on this issue or any other issue benefiting the immigrant community?
No, not yet. That's with the governor's office. We're hoping he and there's also 3 proposals that were put together by the California Latino Caucus in the state legislature. That was one, and there's 2 others that would help immigrants that are here, undocumented immigrants who pay taxes, to be able to get some of the same benefits to other taxpayers that right now have been prohibited. But no, there has not been any confirmation it's moving forward. We continue to ask people to call your state reps and to let them know how important that is, and hopefully they can take action soon. The only other development was the cards that I mentioned here today, that those will not trigger public charge. Those are not run by the government. They come from private donations. And not only are folks who are undocumented not prohibited, they're encouraged to apply for that. So with that, I'll switch that answer into Spanish and say my Spanish remarks. Thanks again to everybody tuning in on the English side who won't stay with us during the Spanish. Check out that data deck. Thank you for all you do. God bless you all, and thank you, LA, for your strength and love back. No hay nuevos pasos con la proposición a tener el crédito de impuestos a nivel estatal, Earned Income Tax Credit, pero el caucus de legisladores latinos en la legislatura tiene un paquete de 3 cosas para ayudar la comunidad indocumentada. Específicamente este es uno de estas propuestas. Espero que toda la gente llamará a sus representativos, al gobernador Newsom, porque nuestra gente necesita ayuda. Necesitamos atender por estas personas que pagan impuestos. Ellos necesitan la ayuda, la asistencia que las otras personas que pagan impuestos pueden recibir ahora. Y este es una empieza, pero también, y en mis palabras esta noche diré más, hay un nuevo programa para asistencia directa en tarjetas con dinero en esta ciudad, y este programa empezará mañana. So with that, con esto, buenas tardes Los Ángeles y gracias por venir. Esta noche quisiera hablarles sobre la importancia de los datos y el análisis en nuestras decisiones enfrentando la crisis de coronavirus y lo que podemos esperar en las semanas que llegan. Y los datos son muy importantes para mí. Todas las decisiones son el resultado de estos datos y el aviso, el consejo de nuestros profesionales médicos, personas que puedan dar el aviso para mí a tomar estos pasos críticos a salvar las vidas de angelinos. Primero les comparto los últimos datos para Los Ángeles hoy. Hoy hubieron 231 9 nuevos casos en el condado de Los Ángeles, llegando a un total de 9,420. En la ciudad tuvimos 113 nuevos casos, llegando a un total de 4,205. Estas son buenas noticias, pero es un aumento. El rato de aumentación es mejor, pero cada día tenemos más casos. Y esta balanza entre los dos aspectos de estas noticias son importantes. Las noticias buenas y las noticias malas. Y hoy fallecieron 25 personas más en el condado, llegando a un total de 320 fallecidos. Y lo siento mucho por las familias de los fallecieron, especialmente durante este fin de semana, durante la Pascua. Y nuestras emociones, nuestros corazones, nuestras oraciones están con usted. En nuestros hospitales tenemos 1,601 camas disponibles y entre ellas 531 están en las unidades de cuidados intensivos y tenemos 1,025 respiradores disponibles. Y seguimos nuestro trabajo para ampliar el acceso a pruebas de detección. Mañana abriremos el segundo centro ambulatorio para pruebas en el sur de Los Ángeles. El primero abrimos la semana pasada en Echo Park. Tenemos ahora 24 sitios para las pruebas de detección en la ciudad y el condado. Y hasta ahora hemos hecho pruebas para más de 46,000 personas. Si tienes síntomas, puedes hacer una cita para una prueba en la página coronavirus.lacity.org/testing. Los Estados Unidos ahora tienen más casos de coronavirus de cualquier país del mundo y hemos perdido más de 23,000 vidas en nuestra nación. California es el estado número 6 con el número de casos más alto en el país, con más de 23,500 casos y 683 fallecidos. Y nuestro condado tiene la segunda más alta tasa de infección y la más alta tasa de muertos en el estado, con 88 casos y 2.6 muertes por cada 100,000 personas. Por cápita, estos números son mejores. Estamos número 45 en los estados por las muertes por cápita. Expertos piensan que lograremos la cima de personas hospitalizadas este viernes 17 de abril y la cima de muertes el domingo 19 de abril. Espero que sí. Pero si interrumpimos nuestros esfuerzos para la sana distancia, los modelos dicen que nuestros hospitales pueden llegar a ser inundados con casos para el 12 de mayo. Y los expertos también dicen que si relajamos la orden para quedarnos más protegidos en casa, ahora podremos llegar a ver que el 95% de la gente se enfermará para agosto. La historia también nos muestra lo que puede pasar si relajamos la orden muy temprano. La pandemia de 1918 nos cuenta 3 cosas. Nuestros esfuerzos están trabajando bien para aplanar la curva y salvar vidas. Pero si levantamos las restricciones demasiado temprano, puede resultar en un resurgimiento mortal. Y debemos prepararnos para otras olas de infección, quizás una segunda y una tercera. Los invito a visitar nuestra página en el coronavirus.lacity.org/data por esta información. Esta es la información que yo recibí cada noche y ahora es disponible para usted también. Además, lanzamos una página para explicar la verdad sobre ciertos mitos sobre el coronavirus en coronavirus.lacity.org/myths. Nos preparamos con la mejor información que podemos encontrar y tomamos decisiones con hechos y datos, no con ficciones. Seguimos nuestro trabajo para proteger a nuestras familias más vulnerables, las que no pueden recibir el apoyo federal. Este es muy importante, especialmente para nuestra comunidad inmigrante. Afortunadamente, nuestro fondo, Mayor's Fund de Los Ángeles, colaboró con mi grupo sin fines de lucro, Accelerator for America, y la red Mastercard's City Possible para lanzar la iniciativa Tarjetas para Angelinos. Esta iniciativa ofrecerá asistencia financiera con tarjetas de débito sin tarifa para las familias quienes han sido duramente afectadas por esta crisis en incrementos de $700, $1,100 o $1,500, dependiendo de sus ingresos y tamaño de hogar. Para ser elegibles, tienen que vivir en la ciudad de Los Ángeles, tener ingresos anuales debajo de la línea de pobreza nacional antes de la crisis y haber sido afectados por la pérdida de un empleo o una reducción de ingresos en la casa. Pueden aplicar en la página web hcidla.lacity.org entre las 8:30 de la mañana los martes y las 4:30 de la tarde los jueves. Si no tiene acceso al Internet, pueden llamar a 213-252-3040 entre las 8:30 de la mañana y las 4:30 de la tarde los martes, miércoles y jueves. Y gracias a mi esposa, Amy Wakeland, gracias a toda la gente que están dando su tiempo, sus dólares, a dar la esperanza a nuestras comunidades más vulnerables. Ustedes están ángeles en esta ciudad de Los Ángeles. Quédense en buena salud, amigos. Quédense protegidos y quédense en casa. Mucha fuerza y mucho amor. Gracias, Los Ángeles. Thank you all. And a special thank you to my wife, a special thank you to Rick Jacobs and to Matt Johnson, to all the folks who helped put that Angelino Fund together that will breathe hope back into families this week. Thank you all. Love you all. I appreciate you. And I'll see you tomorrow.